Good morning, Shanti ma'am. Good morning, Venkata Chalapati sir.
Dr. Kelly sir, good morning. Shanti ma'am, good morning. Good morning.
ಭದ್ರಾಗ ಆಮಕು ಕೂರ್ಸು
Madam, Madam, Shanti Madam. Madam,
Ma'am, okay, ma'am. Good morning, ma'am.
Madam,
Yes, ma'am.
Madam,
Sushila, ma'am.
audible ஆ இல்லையா
மகா
madam?
யோகினி சுசி மேடம் அரைவு
Audible ஆ இருக்கும்.
Hello?
Ma'am, Sushila, ma'am. Audible ஆ இருக்கு, ma'am.
Madam, audible ஆ இல்லையா?
ஒரு
எனக்கு
audio-
Audible, ma'am, audible.
உங்க
மேடம் இப்ப சரியா இருக்கா மேடம்?
மேடம்
மேடம் இப்ப சரியா இருக்கா மேடம்? சாந்தி மேடம்
எஸ் மேம் எஸ் மேம்
ஆடிபிளா இருக்கா?
இருக்கு மேம். யுவர் ஆடியோ கிளியர் மேம்.
சரிங்க மேடம். சார் கேவி சார் ஓகே. இதுக்காகவே ஒரு ஸ்டாண்ட் வாங்கி நேற்று பாப்பா அனுப்பிச்சு. சார் கேவி சார் குட் மார்னிங் சார்.
சுஷிலா மேடத்துக்கு நமஸ்காரம். மகா யோகினி சுஷிலா மேடத்துக்கு நமஸ்காரம்.
ஏதோ
போதும் மேடம்.
அப்பப்பா அண்ணா வந்து அதான் சொல்லிட்டேன் கும்பிடு போட்டேன்.
பெரிய கும்பிட போட்டீங்க அண்ணாத்துக்கு.
ஆமா ஆமா ஆமா. நம்ம டைரக்டர் சார் பார்த்தா எனக்கு வந்து ஒரு என்ன இதாயிடும், கவலை எல்லாம் மறந்துடும். சார் சொல்லுவாரு
தங்கச்சிக்கு ஒரு பெரிய கும்பிடு போட்டேன். தங்கச்சி
ஆமா
சார் போட்டதோட நீங்க உங்க கும்பிடு தான் பெரிய கும்பிடா இருக்கு.
ஆமா. என்ன மேடம் ஆரம்பிச்சிடலாமா மேடம்?
டைரக்ட் சார்
சார் வந்துட்டாங்க. ஆரம்பிச்சிடலாமா சொல்லுங்க.
எஸ் மேம் எஸ்
ஸ்டார்ட் தி செஷன் நவ. ஷார்ப்பா 10:30 ஆரம்பிச்சு.
10:30 ஆயிடுச்சு சார். சார் ஸ்டார்ட் பண்ணுங்க.
ஆரம்பிச்சு.
சார் டாக்டர் சுகுந்தன் சார் குட் மார்னிங் சார்.
டாக்டர்
I'm
சுகுந்தன்
Sushila,
சார்
sir.
குட் மார்னிங்.
சுகுந்தன் சார் குட் மார்னிங் சொல்லிட்டேன்.
சுகுந்தனா சுகுந்தன் சாரா?
Sugundan.
Sir, Dr. Sugundan sir, good morning.
சுசிலா மேம் ஸ்டார்ட் பண்ணுங்க மேம்.
Ladies and
இனிய காலை
gentlemen.
வணக்கம் சார். இனிய காலை வணக்கம்.
Yes, sir. Yes, sir. Ladies and gentlemen, a warm morning welcome to everyone present here. It is a mark of our classic tradition to invoke the Almighty to beginning with any function. So let's begin with the prayer. Thank you. On behalf of the organizers and the Center for Yoga Studies, we are organizing online short-term course program. So today is the 6th day. I welcome beloved Professor Dean Shelvam sir, Faculty of Education, and our Director Dr. K. Venkadajalapati sir, and I welcome today's resource person, Dr. R. Sugundan sir. He is the Ayurveda physician from Chennai, and I welcome other faculty members, teaching, non-teaching, Center for Yoga Studies, and other resource persons who are all participated here, and my dear participants. Now I introduce Dr. Sugundan sir about his profile. Sir has received a humanitarian award from World Red Cross Society in 2018. He received a Best Service Award in 2017 and Varda Cyclone 2016, and conducting various medical camps, and especially 2012 honored by Public Health Department and Corporation of Chennai, and Tamil Nadu Congress conduct the free medical camp at Satyamurthy Bhavan in 2012 and 2013, and Two-Wheelers Owners Association free medical camp was conducted in the year 2013, and Global Cancer Concern India in 2002, Helpage India for Social Service, and Tamil Nadu Physical Education and Sports University first International Yoga Day in 2015, and Art of Living and Gold Certificate Yogantan Challenge, complete 108 round Surya Namaskar and World Health Day 2012, and Tamil Nadu MGR Dr. Medical University is the World Congress on Holistic Health in February 2018, is awarded first prizes in oral presentation, and 4th International Young Scientist Congress Award Andhra and first prize post presentation. Then Ayurveda Maulika Siddhanta Anushadana Parishad 2004, and Harvard Dealer Friends Club for Medical Camp in 2011. And he has attended various national level training program and seminar and skill development for herbal formulation, that is Ministry of Ayush, and Apollo Infection Disease Conference in 2018, Center for Clinical Excellence in Ayurveda, Chennai Art Symposium, Herbal Conference, Ayush Charita 2016, 15th National Conference of Acupuncture Association of India 2012, Central Leprosy Teaching Institute, Government of India in 2018, Institute of Vector Control and Zoonosis, Trainers of Training, organizing by the Support Cap, Clinical Biological, Modern Scientific Tech for Indian Medicine, and he has attended 7 workshops And working experience, he is a KBC Research Center in MIT campus, Anna University. Ayur is hold the position of Ayurveda physician in 2013. Tamil Nadu Physical Education and Sports University as a guest lecturer for Panchakarma department 2014 to 2016, and he has served as state health coordinator for Andhra Pradesh, organized by the RIPS and Tamil Nadu state government comprehensive scheme as RMO 2010 to 12, and Sri Maruti Health Center and Anu's Herbals. So he is preparing a lesson material for a PG diploma in Panchakarma therapy and a basic theory of Ayurveda and anatomy, certificate in Panchakarma therapy, and a basic theory of Ayurveda Panchakarma therapy. He has written as study materials also, and he has presented oral presentation and got a World Congress on holistic health in first prize. Then efficacy of Ayurveda for patients of the treatment of type 2 diabetes. That is the title, and he has presented oral and gender health benefits through Ayurveda oil pulling and mouth rinsing, Tamil Nadu Dr. MGR Medical University in World Congress, and Ayurveda treatment Agni Karma of disease, Calcaneus Spur, 4th International Young Scientist Congress, and he awarded first prize. And he has completed project Department of Epidemiology, the Dr. MGR Medical University and Greater Chennai Corporation data collection for pediatric TB and TB control unit, and the Welfare Association. He is associated with the Arising Youngsters Youth Welfare Association, Ministry of Youth Affairs, and he has got assets, excellent communication skills, dedicated worker, positive worker, ability to work hard. And social works, he is conducting free medical camps, more than 900 medical camps conducted in slum areas. Sir, hats off you to sir on the behalf of the organizing committee and the participants. And we have motivational classes and first aid classes conducting in schools and colleges. So awareness program conducted in schools during outbreaks. So he has completely dedicated his services full up to the society, sir. Thank you, thank you. We had a very good opportunity to have a very good session over to here. Then he has published Agni Karma treatment for the management of a calcaneus spur and journal article, and his skill is expert in both Indian medicine and allopathy system. That is very special for him. And is one more special is having is regarding the sports. He is well versed in Silambam and yoga. Thank you, sir. Thank you very much for accepting our invitation to deliver a very good session and a very good important topic during the epidemic, that is the pandemic situation, COVID-19. And definitely it will be useful for our participants who are all very much interested for the last 5 days. Thank you very much, sir. And once again, I welcome you, sir, to start the session, please. And a few words by our director, sir, Dr. K. Venkatajalapati, sir. Please. Sir, KV, sir?
Yes, madam.
KV, sir is here? Illiya, sir. KV, sir, போயிட்டாங்க, sir? சார் இருக்காரு.
I am here.
சார் நீங்க ஒரு வார்த்தை சார் ஒரு
Welcome our Dr. Sugandhan, Ayurveda physician, on behalf of Annamalai University, on behalf of Center for Yoga Studies. We welcome to Dr. R. Sugandhan, sir. And dear participant, you enjoy the session and utilize the service of great people for your future career. Thank you.
Thank you, sir.
Thank you.
Over to Dr. Sugandhan, sir, please. Thank you.
Thank you, madam. Thanks to one and all. Iniya Kali Vanakkam. We start with the prayer, our Dhanvantri prayer. Adi Vaidya Vitmahe, Arogya Anugrahya Dhimahi, Dhanno Dhanvantri Prachodayat. Our topic is ancient Ayurveda in modern world. Ayurveda is a very ancient one, but still its place in the modern world. How it plays? So during the old age, you used to take rice, but till now we're taking the rice. What are the medicinal plants we use in the ancient period? Still now we're using that. But one thing is changed. During the days, more than 6,000 medicinal plants are used. But now we are using only 2,500 to 3,000 medicinal plants are we are using. That's only the difference. But we are using the ancient and authentic system. The second thing, sir, the definition of Ayurveda. What is the Ayurveda? Ayu means the longevity of the life. It will increase the life. How will it increase the life? It will teach us the lesson how to live the life, how to run the life, and then how to eat, how to walk, how to sleep. Each and everything Ayurveda will teach. This is not a medicinal science. This is purely a life science. So that is, you say as Ayurveda. It will increase the life. Second thing, the WHO organization and all, they recognize the Ayurveda. Now our world are running behind the Ayurveda. Ayurveda, Siddha, Yoga, these are all our traditions. Nowadays, our people ready to follow our traditions. During that time, in between the 100 years, they have forgot to follow the traditions. So only they are accumulated of so many diseases. Now we are seeing about the COVID-19. It's a pandemic disease. It's all over spread all over the world. So don't worry about that. So I will say about Shadvrita. What should we do? What should not be do? Each and everything should be followed. So nowadays people are not following each and everything. During the days, for example, in future we will going to see. So the three masters of Ayurveda are Charaka, Sushruta, Vagbhata. Who is Charaka? The father of medicine is said to be as Charaka. Who is Sushruta? The father of surgery. He done so many surgeries. He used so many beaks of the birds and for the help of surgery. And then they didn't use any anesthesia. They use Datura metal. Datura means it is purely a Umata. In Tamil you say as Humata. And then what for the glucose? Today they're using NS, RS, RL, like that. So many things are they using. But in the past, they use only the coconut, tender coconut. It is access here glucose. So each and everything they use in a very simple manner. So, but our people are doing difficult surgeries, difficult work, so many things. So we should follow our Acharya, Charaka and Sushruta. The blessings of Acharya, Charaka and Sushruta. Now I am sitting in front of you to talking about that Ayurveda. So Ayurveda is a gifted one. It's an Amrita. We say as Amrita of Lord Dhanvantri. It is given a nectar of honey. What we should eat that Ayurveda. We should drink that Ayurveda. So we can feel that happiness of the Ayurveda. Second is, what are the branches of Ayurveda? There are so many 8 branches of Ayurveda. There is Kaya Sikicha. A Kaya Sikicha deals with the inner medicine. Kaya means body. It deals with the inner medicine. And then Bala Sikicha. Like that, allopathy system, we also deals with 8 types of branches. Is having a pediatrics. It deals only with the pediatrics science. And then Graha Sikicha. None other the systems deals with this type of evil spirits. Mani Mantra Aushadam. We say as Mani Mantra Aushadam. The evil spirits, some of them are external doshas will occur. The Nija and Agantu. Nija is internal. External is Agantu. So the external doshas, the evil spirits will occur. So we do as that money by wearing the monies and then arti. So drishti to release the drishti, like that. So many things we follow. And then Urdhvanga Sikicha, Ashalya Sikicha. We deals about the ENT, eyes, ears, nose, throat. Like that, we deals with the signs of ENT. And then Shalya Sikicha, surgery. What the surgery they using in the modern world? We are the first persons to do the surgery in the world. Lord Acharya Sushruta plays a major role in that. And then Damsana Sikicha. Damsana Sikicha is toxicology. We deals with the toxicology plants, and then some of the toxicology poisonous animals, like that we follow that. Second thing, Jara Sikicha. Jara Sikicha is based on only in Rasayana. The Rasayana plays a major role in our body. Why? Because in the Rasayana, what will do means the Rasayana will help to regenerate the cells. So the Rasayana plays a major role. And then Vrishad Chikicha. Vrishad Chikicha is our Vajikarna Sikicha. Vajikarna Sikicha is used for, in the olden days, is used for to enhance the youthness. It will increase in the sexual power, and then Vajikarna therapy is mainly is used in the olden days. Nowadays, people are not following that. So each and every food, every fruit having that power. Nowadays, we are not giving more importance to the fruits and vegetables. So many fruits and vegetables are very important in that. And then where the disease arise, because of what? In yoga, they will follow. In Siddha, they also say about that kama, dharma, artha, kama, krodha, lobha, moga, mada macharya, shoga, bhaya. So these are the main causes of disease. Why? Because one was free from this dharma, artha, kama, moksha, lobha, they are free from the disease. But we are holding that, each and everything we are holding in that. So we have each and every problem arises because of this only. This is the root cause of disease. This is the root cause of all the diseases. So if you free from the disease, the Acharya Patanjali said about that. So we should be free from this. We can free from the disease. So next thing, Ayurveda depends upon Hetu Skanda. That is, Hetu Skanda means is the etiology, and Linga Skanda, the signs and symptoms, and then Aushadha Skanda, the treatment of diseases. We are treated in the step by step. In the Ayurveda depends upon the Hetu Skanda. Hetu Skanda is etiology, how it will come, where it will occurs, and then Linga Skanda, signs and symptoms. What will be the signs and symptoms of this disease? So we give more importance to the root cause of the disease, and then Aushadha Skanda, what will be the treatment? How it should be planned? Each and everything is said to be in the Ayurveda system. Each and everything is said. What about the three doshas? The three doshas plays a major role: Vata, Pitta, and Kapha. Our Tiruvalluvar is an old grandfather of Tamil. Said about Vata Nadi, Pitta Nadi, Kapha Nadi. It should be in that is he said clearly about Noi Nadi, Noi in Mudal Nadi. So we should see that Noi. How it comes means through the Nadi. Nadi plays a major role. We should calculate the patient about the Prakriti Nadi Pariksha. Nadi Pariksha plays a major role. Vata Nadi, how it works. Pitta Nadi, how it works. Kapha Nadi, how it works. So in this condition, even in Purana, we calculate the Nadi as Vada Kapha Nadi. Vada Kapha Nadi, if joined together, it will raises the COVID-19. So if you reduces the Vata and Kapha Prakriti level, it will decrease the COVID level. So we are treating for the root cause of the disease, not for the disease. So Ayurveda plays a major role in that. Vata plus Kapha, Pitta plus Kapha, each and every Prakriti will plays a major role. If some of the Kapha persons, he will accumulate with Vata and Kapha. Some of the persons, Kapha with Pitta. Some of the persons, Pitta with Kapha, Pitta with Vata. Like that, it will be calculated under the calculations. So depends upon the Prakriti. Even your father and mother, Matru and Pitruja, plays a major role in this. What the major role in this? They given the good things, all the not only the organs, not only the things, even Manoroga also it will be increased. Sattva, Rajas, Tamas. So we can change the Manorogas by free from the, what do you say, the Dharma, Artha, Kama, Moksha. If you free from Dharma, Artha, Kama, Moksha, we can free from the disease. Next thing, Vriddhi. What is the Vriddhi, Shaya, Utkrishta? Vriddhi means the disease increasing. So how will disease will increase? If you eat, some of the persons after 40, if they eating the gastric problems, gastric problem will arise. Vata will be increased. Why? Because they eating the potatoes, the cauliflower, and then etc. like dals, like that. If you decrease the amount of this dal and then the gastric vegetables, automatically we will free from the Amavata. automatically we will free from the Amavata. So like that, each and everything is calculated among the food. And then Agni. If the patient having Vishamagni, Tikshna Mandagni, we have to calculate that. So if the patient has Tikshna means the HCl acid will be increased. Automatically the Pitta will be increased. If the patient the HCl will be increased means automatically the Pitta will be increased and the Tikshna will be increased. So because of that only, so many of them having the some ulcer. So some of them having that, having a frequent thirsty, frequent digestive. If the digestive power increases higher and higher, they should eat. They're having some burning sensation all over the body, etc., etc. If the patient having the Manda Agni, if they're having the Manda Agni, they have no appetite. If, for example, the people, the small children having no appetite. Why? Because the Manda Agni plays a major role in that. So we have to increase the Mandagni into Samagni, not a Vishamagni or Tikshnagni. If you the Vishamagni is increases, automatically what happen? The entire digestive system will be collapsed. So each and everything we have to follow the criteria. So now our people, each and everything will watch. We say to the patients, please maintain this. Sleep early morning by Brahma Muhurte Uttishtatu means 3 to 6 o'clock. It's an ideal time to get up, and then you should take the breakfast in that before 9 o'clock, and then lunch in the 12 o'clock, and then your dinner at 7 o'clock. So it will be the ideal time to take the food. If you're taking in the ideal time, the Agni will be maintained. If you taken in the inappropriate time, the Agni will be the Tikshna Agni, maybe Mandagni, maybe Vishamagni. So the Sama Agni will not be there. So each and everything we have to concentrate in that. And then the HCl patient HCl will be increased along with Vata in the Pitta patient. And then Shadrasas. Our Ayurveda say about the Shadrasas. First, I'm saying each and everything, what are the things we have to follow, and then I will explain each and everything. Shad rasas. Shad rasas is Swadu Amla, Lavana Tikta Ushna Kashaya. The Swadu Amla means the sweet, sour, salt, butter, bitter, and the pungent and astringent taste. It plays a major role. Our Amla having all the taste. So only without a Lavana taste, so we are just taking with a Lavana. Amla is taking with a Lavana taste. But balance 5 tastes along with it is in the Amla. So only our Avayar know very well. I think each and every person know about Avayar, the old lady, but brilliant lady. Avayar given that Amla to Adiyamma. Why? Because it is it's not only a fruit. It will regenerate the body. It regenerates the cells. It will it will gives only good to the people. So our Avayar prescribe this Amla to that Adiyamma. Second thing, the sweet sour salt will mitigate the Vata. Sweet sour salt will mitigate the Vata, and bitter, pungent, and the astringent it will mitigate the Kapha. Kindly note it. Those who are the older person, it will be more important. In future, I will say about this. Sweet sour salt, it will mitigate the Vata. And then bitter, pungent, astringent, it will mitigate the Kapha. And then Kashaya Tikta Madura. Kashaya Tikta Madura, it will mitigate the Pitta. So Kashaya Rasa, it will mitigate the Pitta. If you following this criteria in your food, automatically we will free from the disease without taking any medications. So it plays a major role, sir. In olden days, in Tanjavur side and in Pudukkottai Karaikudi side and all, they put some very long banana leaf, and then they will keep each and everything, including the honey with ginger. Why? Because it plays a major role to digest. So in Ayurveda say about that Ama. Ama means the indigestion problem. Ushmano alpa balatvena dhatunam ama apachitam. Ushmano alpa balatvena dhatunam ama apachitam. What's the meaning of this mean? If you eating the dinner in the before night, before day before yesterday night, It's not digested in the morning. Again, you're taking the food. It will accumulate in the channels of the alimentary canal. It can't digest. So it can't digest means what happened? Automatically, it will form the ama. So it plays a major role. If you take drinking hot water along with the jiraka, automatically the ama will be reduces. So the indigestion problem will not be occurs. Some of them having some belchings. The continuous belchings will be occurs. Why? Because the continuous belchings, what will happen means the Tikshna Agni will be increases. If the Tikshna Agni will be increases along with the Mandakini, automatically the indigestion will be occurs. So we have to note down each and everything. What is the Virya? Virya is Ushna Virya and Shita Virya. Each and every person depends upon the Ushna Virya and Shita Virya. If they say as எனக்கு வந்து சூட்டு உடம்பு இருக்கு, எனக்கு வந்து குளிர்ச்சியான உடம்பு இருக்கு. So if you have to calculate that what type of prakriti, what type of nadi, what type of virya. If the patient is in Ushna Virya, we have to treat it to be maintain the equilibrium state. If the patient in Sita Virya, we have to take in to maintain the equilibrium in the equilibrium state. Why? Because if the Ushna Virya means the Pitta will be increases. Along with the Pitta, the Rakta also will be Dushe, and then the Rakta Pitta will be increases. So we have to maintain that equilibrium state. Our Tiruvalva is a very excellent said about each and everything. We have to maintain that Vata Pitta Kapha in the equilibrium stage. So we have each and every saint say about this. We have to maintain the equilibrium stage of our body. So the Vata Pitta Kapha in the equilibrium stage, automatically the disease will not be occurs. So we have to maintain each and everything. So not only that, if in the Shita Virya, if the patients in Shita Virya, what will happen? Automatically the sinus problem will occurs, the headache will occurs, the respiratory problem will occurs, the tuberculosis, like that, so many diseases will occur. So we have to maintain that equilibrium stage in our body. So what will happen each and every day? It should not be Ushna Virya, it should not be Shita Virya. So we should maintain the system. Next, Mahagunas, Sattva, Rajas, Tamas. In yoga, it plays a major role. Sattva, Rajas, Tamas. Each and every system of our Indian traditional system, Siddha, Ayurveda, Yoga, Tibetan system, whatever may be, it says about the these are Mahagunas. What will happen if the Sattva Guna along with the Kapha, the person will be very calm. Why? Because he eating the Sattva food, he eating about the Sattva thing, he is having the Sattva thinking, he always is speaking only the Sattva things. So the disease will not be occurs. If the patient along with Pitta with Tamas or Rajas, the cruel thing will be occurs. The cruel guna will be plays a major role. So the gunas all plays a major role. Each and everything. Why we doing this puja, prayer? Even in all the religions, in Muslims they be doing namas, and then the Christian playing role in a church, and then we doing prayers in the temples. Why? What's the reason behind that? Is to come to the Sattva Guna. Each and every Guna plays a major role. The Valmiki, for example, our Valmiki born in a Rajo Guna and then Tamo Guna. Finally, he converted into a Sattva Guna. So while we using that gunas, it plays a major role. The Mano doshas, but we say Sattva Guna as a doshas, but Rajo and Tamas plays as a Mano doshas. If you're doing the cruel things, if you're beating our children, if you're shouting with our children, if you're fighting with our nearly persons or our neighbors, what happened? The Rajo and Tamo Guna will be increased. So if the Rajo and Tamo Guna will be increased, automatically our mentally we are disturbed. So our Acharya says, please maintain our Sattva Guna. So each and everything, not what said, now is COVID is not a corona. It's purely a karma. What the karma we done, we are getting the fruit of karma. We are eating the karma. This is not a corona. So corona go means it will not go. We have to play a major role for karma. So we should pray for karma, and what the mistakes we done, we have to rectify that. Our environment, our nature, each and everything say about that karma. So we have to free from our karma. So then we have to increase our sattva guna in our body, in mind, everything. It will be plays a major role. Next, roga. Roga plays into nija and agantu. Nija is internal and agantu is external. What and all the bacteria and then fungal and then etc. It comes from the away from that. Not only the bacteria, fungal, etc. Even the evil spirits. It plays a major role. It will comes out from the outside. The nija means it plays in the sattva, that manoguna, manodoshas, and then in between inner body, what and all the disease takes place is called the nija. So we should be free from the nija disease. And then rogi roga pariksha. In Ayurveda, what you will say, rogi roga pariksha. How will pariksha means? Pariksha occurs means the inspection, palpation, cushioning, and then etiology, symptoms, signs. Darshana, Sparshana. We are giving more importance to Darshana. We should see what are the complaints they are arising from, how they are maintaining the body. While seeing the Nadi, Sparshana, and then maintaining the Neikuri, you say as in urine, what the color of the urine, what the color of the fecal, what the color of the tongue, what the condition of the tongue. So each and everything we have to see that. Kala plays a major role. Kala means time. They are having 12 types of Kala Muhurta. So we have to calculate the medications along the Muhurta. Adho Bhaktam, Pra Bhaktam, Madhya Bhaktam. So we have to take the medicine in between or in before or after food or in between the food or after two boxes of food. So we have to calculate each and everything of that time. Not only the time. Uttarayana, Dakshayana. In Uttarayana, what are the food should take? In Dakshayana, what are the food should take? Each and everything, we have to follow that. In previous conditions, they say about each and everything about that Uttarayana and Dakshayana. In Uttarayana, what are the therapists should do? What are the therapists should not do? In Dakshayana, what are the therapists should do? What are the therapists should not do? The Shodhana and Samana Chikicha should be done. In all the conditions, the enema should be taken. It is a very best purificative therapy. Maybe in Uttarayana, maybe in Dakshayana. We can using that enema in a yoga also plays a major role. I think so. You can using that enema and then you can use that Anutailam in all the Dakshayana period or in the Uttarayana period. Why? Because it will cleanses the body. If you taking the Anutailam Tado Nasyam, Anutailam means it's a drops, it's made up of the Ayurvedic medicine Anutailam along with the sesame. If you pouring that in that nasal drops in two drops daily, what happen means it will be free from the kapha disorders. It will clear the kapha disease. And then if you doing that enema, even the alternative days, we have different types of enema. Having Niruga Basti, Asana Basti, Kashaya Basti, like that. Basti is we say enema as a Basti in our system. Each and everything, if you are taking that enema in the daily, the alimentary canal will be clean. Nowadays, the people are having so many problems in the digestive problem. Digestive system plays a major role nowadays. Why? Because nowadays we are taking so many pizzas, burger, so many outside foods, fast foods, like that. So many things we are taking this. But we have to control these foods. We have to cook in our home. We have to take the food. Each and everything nowadays we have to follow that. In Kerala, excellently they are following the Karangali water. The Karangali water plays a major role in that. What it will do means while taking the Karangali, it will clear the alimentary tract canal and it will calm down the alimentary tract canal. But In our system, in our Tamil Nadu, we say about Jeeragam. What is Jeeraga? Jeeraga means it will digest the internal system of alimentary canal. But we are not using that. In Pongal, all the items are in that Pongal. But our people, what will do? You take all the that pepper, the Jeeraga, that coriander leaf, and then each and everything. It contains all the protein. Those who taking the daily Pongal in the tiffin time, in the breakfast time, it will be good. But we given the name. It's a sleeping dose. It's a best sleeping dose more than our mother. So we are not following that our traditional foods like millets. So millets plays a major role. We are not following that millets. And then what are the fruits like Goa? In Hyderabad University, they discuss about so many things about Goa. Our people want to go for Goa. They go for apple. Why? Because it's very costly, and then it's come from US like that. Our people won't bother about our Indian food. Each and everything over last 10 years back, I think so, noni plays a major role. But in villages, in black noni plays a major role. Usually they used to take that. But they sell for more than 1,000 rupees. Are people ready to purchase that? Goa, and then jambu fruits. Jambu means it's a naval padam. Naval padam, it plays a major role in diabetic. Our people won't eat that fruit. Why? Because that's very cheap. So they won't give importance to that naval padam. Avarai undal savarai kandadundo. That's given by our sister. Avarai undal savarai kandadundo. While you taking that avaram 2, avaram leaf, avaram extract, avaram kashayam, we will be free from the diabetic. Not only free from diabetic, it will reduce the hair falling. It will enhance the color, enhance that skin tone, etc., without taking any type of chemical reactions. So our people in olden days, they're giving more and more. And then the purification therapy, Basti, and then Virechana, and then Vamana. What's a Vamana therapy, sir? If you are indigestion, if you occurs the indigestion problem, kindly go for Vamana therapy. Simple thing. If you're taking the Vamana along with Madana Phala, automatically the Vamana will be occurs. So you can go for Vamana. If you're doing that Vamana, the Pitta will expel very easily. So you should not go for any type of medications. In Ayurveda, having Panchakarma therapy is there. In the Panchakarma therapy is Vamana therapy, Virechana therapy, Vasti, Raktamokshanam, and then the Raktamokshanam, Samana Shodhana Chikitsa, it plays a major role. Our Agni Karma. I will deal more with Agni Karma. In the Kalkanespar cases, we deal with Agni Karma. So it gives instant relief in that Agni Karma. While using that Agni Karma, we can give the instant relief within one day. In allopathy, they used to say, please go for operations. Without operation, within 2 days, we can give the excellent results. Leech therapy. We having that Ayurveda having the leech therapy. Our people are not ready to come. Nowadays, the people ready to come to Ayurveda, but now it's very costlier and costlier. So in the olden days, in Triphala, we can get it in the 20 rupees of Triphala, but now it's 50 rupees. We just miss to get the fruit of Ayurveda. Now each and everything is very costlier. Why? Because we didn't get the raw materials. Sir, our Anjarapati is the best medications. In our system of medicine, the Anjarapati plays a major role. Why? Because the Anjarapati contains the fenugreek, Vendayam, Pattai, Lavanga, and then Chiraga, pepper, Shunti. Shunti we say as Shunti, Sukuk minje Maradum illai, Subramaniki minje Samiyum illai. நம்ம டெய்லியுமே சுக்கு காஃபி சாப்பிட்றப்ப நம்ம இந்த கஃபத்தை பத்தி யோசிக்க வேண்டிய அவசியமே இல்லை. நாட் ஓன்லி கஃபா, ஈவன் இப்போ வரக்கூடிய சாஸ், கொரோனா, அந்த நெக்ஸ்ட் இனிமேல் டு நெக்ஸ்ட் எம்எஸ்சி, அதாவது மல்டி சிஸ்டம் ஃபெயிலியர் அப்படின்னு சொல்லுவாங்க. மல்டி ஆர்கன் ஃபெயிலியர் போய் மல்டி சிஸ்டம் ஃபெயிலியர் வந்துருச்சு குழந்தைங்களுக்கு. ஸோ அப்டேட்டடா இன்னைக்கு நிறைய விஷயங்கள் ஆஸ் எபிடமியாலஜிஸ்டா நாங்க பாக்குறப்ப Each and every problem will be occurs because of this food habits. Each and everything they're using the oil. We are having so many advertisements in the oil companies, but they are taking all the good things from the oil. They're giving you more pressure and taking all the oil, good substance from that oil, and they export in the outside. But we are taking that third grade, fourth grade of oil. Please go for check oil, and then we can do that oils in that. Usually they use a gingerly oil, so that you say as a nallanai. We have to do the oil pulling daily. Just we do the oil pulling daily, what are the results we can feel each and every day? It will reduce. What are the benefits of that gingerly oil means? It will reduce the joint pains. It will reduce the joint problems, and then it will reduce the gingivitis. It will reduce the. It will gives more preference to the gums, teeth, and then it clear from the mouth osteo problems. And then automatically we should not go for yearly plugging in the teeth. So each and everything while you doing the Gandusha for the 5 minutes. If you spending 5 minutes of Gandusha, we can be clear from the all the mouth problems. Not only that, it will clear the throat problems. The throat and the throat from you should not take it very easily. While you doing the Gandusha, we can clear the throat very easily. After the Gandusha, what we will do means just pour a water along with that turmeric and salt in a warm water. Just take a warm water and gargle like anything for 2 minutes. It will clear all the osteo problems, osteorogas. Not only that, it give a enhance and richness in. It will give the ojas also. So while doing that Gandusha therapy, we can see so many things. And then Vyadi, we can calculate the Vadi. Sadhya, Asadhya, Kritra Sadhya, Yapya, Anupakrama. What is the Sadhya? Sadhya is curable disease. Having in Siddha, they are saying about the 4,448 diseases. Among the 4,448 diseases, which will be curable, which will not be curable, which will be sadhyable, which are asadhyable, and Krishna sadhya curable with difficulty, and then controllable, and then unmanageable. What are the diseases controllable? Is diabetic. In some of the kapha patients, it is curable. Diabetic is controllable, but in some of the cases, it is curable. And then most of the disease we can cure, sir. But for exception, baldness we can't cure. So many of them giving so many ads. Amazon from the Amazon we giving the oil for that. If you seeing that hereditary, if the father having the baldness, or your grandfather having the baldness, you can't cure that. So each and everything we have to give some of them giving a wrong statements. Please don't believe that at all. Our Ayurveda is clearly about each and everything. What should we do? What should not be do? When should we do? When should not be do? So each kala we can follow each and every kala plays a major role. So for hair, doing that because of Ushna, the hair will be fall very easily. So we have to reduce the Ushna level. So each and everything we have to follow that. We can calculate the disease. It is Kricha Sadhya or Asadhya level or Sadhya condition. We have to first calculate that. Then we can teach. Then we can teach the people. Madam, this is easily curable disease. It is very difficult to curable disease. But with your support, we can cure the disease. Without changing the food habits, we can't do anything in the curing the disease. For my patients, I will teach very clearly about the food habits. Without food habits, we can't do anything. First, we give more importance to the food habits. We should give for the kala. We should give for the time, and then doshas, rogas. Each and everything plays a major role in that disease to cure the disease. The nasya. We already talking about the nasya. Nasya, what will do, sir? If you taking the nasya daily, what will happen means it will enhance it will clear from the baldness. if they started for the baldness means it will stop that. And then gray hair, and then who are having some white hairs, it will be converted into a black hair in future. So if you taking the Nasya daily, it will gives a excellent result. It will relieve from kapha disorder. So we can follow the Nasya. Gandusham is a very important thing. Daily we should do the Gandusham. Why? Because if you taking the Gandusham daily, already I said you can be relieved from the joint problems. And then Tambula. The Tambula is nowadays we forgot about the Tambula. After finishing the food, we should take Tambula. The Tambula means Vethalai Paku. Vethalai Paku means we should not add a Vethalai Paku. ஒரு 2 வெத்தலைகளும் அதனுடன் லவங்கம், பட்டை, அதனுடன் பச்சை கற்பூரம், ஜாதிப்பூ, ஜாதிப்பழம் இதனை சேர்த்தே பாக்கிடுதல் வேண்டும். அதாவது என்ன கேட்டீங்கன்னா, இந்த வெத்தலை கூட இந்த லவங்கப்பட்ட ஒரு கிராம்பு, ஒரு சின்ன லெவலுக்கு கொஞ்சம் சீரகம் போட்டுட்டு நம்ம இதை சாப்பிட்டு வந்தோம்னா எப்பேற்பட்ட இன்டைஜஷன். நம்ம எப்போனா when you going for non-vegetarian only we are taking that tambula. So on the time we getting the digestion. Each and every day we should take tambula. In olden nowadays you see in the village more than 80, 85, 90 that people are taking the tambula, but they are still strength having that all that calcium level is very high. How it is possible? Because of that that sunambu plays a major role in that calcium beta blockers. So they are doing very simply, but we are going for any other any private hospitals, they're giving the beta blockers for a cardiac patient without any tablets. They are good, they're following the good hygiene, good food, good habit. Why? Because in the morning they used to take in the morning they used to by Brahma Muhurta they uttishthatu in that 4 to 5 o'clock, and then they're doing that with the help of neem bark or whatever may be. That the strength of the people is neem bark. They're doing that that toothbrushing, and then they are clear with that, and then after that they're taking that old day food, that paludu, that will give you a more energy level. So if you nowadays, even I follow that in corona time, each and every time we used to put the tambula. Sir, if you using the tambula, we can be aware, we will be free from the bacteria and fungal. Why? Because the tambula having that much of action. It's having the sanitary action. It will be free from the fungal and bacteria action. Why? Because we done the research in the King Institute. It gives a major role. What are the things I said? Lavanga, Jatifal, and then Jatipatra, Pache Karpura, and then what are the things what I said? We are all given in the King Institute and we tested. They are shocked. Why? Because they are free from the corona. So we can use in our daily purpose. And then the best Ritu means month. Which month is best for our means? The Hemanta Ritu is the best Ritu from mid-November to mid-January. Hemanta Ritu is the best from mid-November to mid-January. What are the things we have to do? Means plan in mid-November to mid-January. The next is Shishira Ritu. The Shishira Ritu plays a major role from mid-Jan to mid-March. Actually, there is having some Rutu Sandhi. The Rutu Sandhi is last month and this month joined together is called as a Rutu Sandhi. So if you're giving more importance to November to Jan and Jan to March, it gives a major, it plays a major thing, and it will be good for thing. If you plan for any Vajikarna therapy, if you're planning for any other to reduce the weight or whatever may be, it's an ideal time to do that in that season. Why? Because there is not too high Ushna or not too low Sita. So it will be in the calm stage. So we can follow that. And then source of water. Which water is very good to our health? It means our nearby mountain area water is very good to health. Is easily digestible. The soft water is easily digestible. The soft water We have to maintain the soft water is very easy to digestible, and the hard water is difficult to digest the digestible. And then what are the water from lake? The lake water is plays the lake water gives more important in this. So each how to purify the water. How to purify the water means by using the parinama mula. It's one type of way. And then tamari tandu is tuber of lotus. And then pearls, seeds of kataga, serangote. Still in our villages, we are using that serangota. Serangota means just the olden ladies என்ன பண்ணுவாங்கன்னா அதை எடுத்து அந்த மூக்கோட என்ன பண்ணுவாங்கன்னா அந்த பானையில நல்லா சுத்துவாங்க. அந்த பானையில் நல்லா சுத்திட்டு அதை என்ன பண்ணுவாங்க சார், நல்லா அதை அலசிட்டு அதை வந்து தண்ணியில வந்து தண்ணி எடுத்து வைப்பாங்க. அந்த கம்மாயில இருந்து தண்ணி எடுத்து வைப்பாங்க. இஃப் they take from the lakes and the ponds, whatever may be, they take the water from the lakes and ponds, and then they keep for one day. What will happen? It will sediment all the unwanted things in that bottom. Finally, we can drink the pure water. After that, they will go for heating process. So after that, we can drink the water. We can use in our city side also. If you drinking that mineral water means cut one amla in that cut one amla or pour the amla in that water and or lemon. So if you 2 days once we have to change it definitely, and we can use padiyaram. And then tamra tandu, tubers of lotus, we can use it. It will be cleanses the water. Sir, nowadays we are not drinking the proper mineral water. What the water we drinking is not the mineral water. It's purely contaminated water. So what our mineral water is purely a groundwater, is only a mineral water. So we are not following the any type of grounded water nowadays. We are giving more importance to the or the mineral water. While you taking the mineral water daily, what will happen means the fluoride level will be increased in the teeth. The fluoride level will be decreases means what will happen? Automatically the teeth will be shaken. So nowadays the enamel will be gone very easily while taking that mineral water. But the groundwater level, the groundwater is more having the mineral substance, but we are not giving importance to the mineral water. Our King in King and Show, they're having so many studies in that. What the studies means, if you taking the water which contain the iron content is more, we should not take. If the copper content is more, we should not take. Why? Because we should maintain the mineral level in the base. If you taking that mineral level more means our teeth color will be changed. Daily, if you doing the gandusha daily, automatically it will be clear from the disease. What means the tooth disease? Our next thing, the purification, the ama ajirna and vishtaba jirna. Next thing we seeing about that digestion process. Sir, each and every day we should maintain from the starting till now I'm saying about that kala. Kindly make plan and eat in the time and tide. Why? Because that while we maintaining in the time, we can free from the disease. If you take in the very our food will be in the hot means none of the bacteria none of the things will be occurs. But if you are eating in the 2 o'clock, 3 o'clock means automatically our ajirna will be forms. So please plan for eat in the time. Give more importance to eat in the time, sir. So if you giving the importance to the time, sir, we are running to earn the money. Finally, what happens? We are running to the clinics and hospital to give the money to the doctor. Please plan for yourself for minimum of 1 hour. You spend your minimum 1 hour to your body, for your mind, to calm your mind, to calm your body. While doing yoga, it will play a major role. So each and everything will play a thing. While doing yoga, what will happen means the asanas, pranayamas, and then the asanas will be free from their problems.
Hello, sir.
So, yes, madam.
Yeah, can you talk little bit about infertility problem? We are facing many ladies nowadays, infertility, number of
Okay, madam.
infertility patients.
Okay, madam.
Thank you.
Thank we are our ladies used to follow in the early morning and do the exercise. How what type of exercise means by grinding and then doing some exercise like that, bending and walking like that. Nowadays we are using we are not walking also. The obesity plays a major role in infertility, in female infertility. Not this level is very low. The eggshell, sir. Eggshell.
Yeah.
In eggshell contain all type of minerals and minerals.
Yeah.
So if you taking that eggshell and then what will happen? You should pour in that hot water and then boil in the 100 degrees Celsius and then take that and then dry it and clean it very well. Make it a fine powder and vasragayam. Vasragayam should be done. After that vasragayam, daily in the morning and night time, 1 spoon along with the milk. It gives a nice result after 3.
Any Ayurvedic alternatives I have never taken, but listening to you, I feel motivated to go for hypothyroid, in thyroid medicine instead of that, or in supplement with that.
Okay, madam. Good question. Thank you. Actually, we go for Arogya Vardhini Vati.
Okay.
Arogya Vardhini Vati.
Okay.
It is a best regenerator. Kanchanara Guglu.
Okay.
Arogya Vardhini Vati and Kanchanara Guglu morning in the empty stomach. 2 Kanchanara Guglu along with 1 Arogya Vardhini Vati.
Okay.
It is Arogya Vardhini Vati available in IMCOPS and Kanchanara Guglu also available in IMCOPS.
IMCOPS? What is IMCOPS?
IMCOPS is a government product. We can get it from pour in that rice. After that, we should eat. Daily minimum of 1 spoon should be eat. So many of the people think Grita means it will increase the cholesterol level. Grita should not increase the cholesterol level. It is a good cholesterol. Each and every person should take the Grita daily. So then only our people educated giving the false statement in the very easily level. So you can take the Grita. It is a good cholesterol. You can take the Grita daily. Not only that, you can take the gingerly oil for the gandusham, for the cooking purpose. We can take the which oil is best means Yeranda Thaila is best. We can drink the Yeranda Thaila daily, sir. In the night time, you take the 1 spoon of Yaranda Thaila means what you say in Tamil we say Amanakenna, Velakenna, like that. We can take the 1 spoon of Amanakenna daily. What will happen means it is in the bitter and pungent sweet taste. It cures the scrotal, even it will cure the hernia problem, and even then abdominal tumors or any other abdominal problems occurs means automatically it will be cured. If those who having the indigestion problem, those who having the mandagni, those who having the vishamagni, those who having the tichnagni, I giving you one solution for that. You take that Yaranda 1 liter, Yaranda oil 1 liter, and then garlic, make a fine paste, and then ginger fine paste. It's equal ratio. It is in 100 grams, means same in the 100 process, 100 grams, and then it is to make it in a boil, and finally filter in that filter. Daily take 1 spoon of that Ingutri Gunatailam is named as Ingutri Gunatailam. It's called as Ingutri Gunatailam. And those who having the Ama Ajirana or Vishtava Ajirana, kindly take Ingu Astaka Churnam or Bhaskara Lavana Churnam. It plays a major role in Ayurveda to cure the disease. And then what do you say? Each and everything we have from the morning till the night. We have to, not only that, sir. Nowadays, I forgot to tell about that. Each and every person, minimum 2 days, they should do the oil bath. If you're doing that oil bath, automatically the male fertility, because of the heat only, the male fertility and female fertility occurs. So because of heat only, the hormonal problems will be changed. Because of heat, so many things will be changed. The piles will be changed. So you have to reduce the heat by doing the oil bath. If you're doing that oil bath, you can be reduced from all the things. So,
Which oil, sir?
Ginger oil we can use, ma'am.
Okay.
Ginger oil is the best. So we can use the ginger oil. And then for conduction purpose also, we can use ginger oil. In those who are having some joint pains, severe joint pains all over the body, they can use along with neem oil and ginger oil. Just pour a little bit of pachakarpuram or whatever pungarpuram, and then heat it level, and then make a good malish in all over the body. It will give a nice result within 5 days. Within 5 days, it gives a nice result. Why? Because it will reduce the what do you say? It will reduce the inflammation level. So we can use that. And then what are the things means the buffalo milk? Those who are having the insomnia problem, if you take the buttermilk, buffalo milk along with gasagasa, we say as gasagasa, automatically they will be relieved from within 10 days from the insomnia problem. And then takra, those who are having some hepatitis B problems, sir. Nowadays the jaundice and hepatitis B plays a major role. Kindly take coriander leaf juice daily for 48 days. It's a best. Kindly give your feedback after using this. You using that coriander leaf juice without any mixing water or whatever may be. It gives a nice result. After using this, you can feel that your liver condition and then your kidney condition, sir. Not only that, that's so miracle is there. If you taking that coriander leaf daily, your urea creatine level also will be maintained in the normal state. So nowadays we are not giving more importance to the coriander leaf. So if you're giving more importance to the coriander leaf daily, it will be free from that urea creatine, and then SGPT, SGOT level will be very normal in condition without taking any medications. So each and every day nowadays we are seeing about that fatty liver cases along each and every hospital every year. Why? Because the food level is very worst. We are taking so many daldas. So kindly take that Bhumi Amlika. Bhumi Amlika means it is Kiranelli. At least minimum of one weekly once. Kindly take Kiranelli or Karslangani. Karslangani plays a Bringaraja. Karslangani means it's a Bringaraja. Bringaraja plays a major role for hair growth, for tone up a liver, and then tone up a kidney, and then it will increase the iron condition. Mainly, it's for the human, it's for the woman special. we say as a woman special, so we can use that. And then the coriander leaf, we give more importance to the coriander leaf. Kindly, those who having some indigestion problem, we can take the draksha. Those who are having the diabetic, kindly take avarambu. So it gives a jambu fruit seeds. It gives a more important. And then yoga plays a major important role. Nowadays, our PM also giving more importance to this yoga. Kindly give more importance to the yoga. Our university, Annamalai University, is plays a major role in the yoga. Not only now, they are doing from the day before yesterday. I think so. Dr. Ilavan sir also speak about the yoga. I think so. So giving more importance to that yoga. If you giving more importance to the yoga, automatically we can reduce our money for giving to that doctor. In Tamil we say as யார் வந்து வாணிகனுக்கு வந்து செலவு செய்கிறார்களோ அவர்கள் வைத்தியனுக்கு செலவு செய்வதை கம்மி செய்து விடலாம். எல்லாருமே வந்து இப்ப என்னன்னா டாக்டருக்கு காசு கொடுக்கறதுக்கு நம்ம ரெடியா இருக்கோம். ஆனா நம்ம டாக்டருக்கு காசு கொடுக்கறத விட மர்ச்சன்ட்டுக்கு, அதாவது வந்து ஆயில் மர்ச்சன்ட்டுக்கு போய் நம்ம காசு கொடுத்தோம்னா நம்ம நோயை சரி பண்ணிக்கலாம். ஆனா நம்ம என்ன பண்றோம்னா we are seeing that ads, the sunflower, and then so many ads are coming. So we are just believing that ideally this is and all the good oils, it's good for health. It's purely ambak and purely it's a fake thing. So kindly go for our check oil and it is, hello.
Sir,
Audible, sir.
Yes, audible, ma'am. So you just go for a check oil or whatever may be. It gives more important. Even coconut oil also, they are having so many adulterations, sir. They are using the sulfur for they're using sulfur in the coconut before that doing oil. Why? Because if you are adding the sulfur, the coconut oil will not be சீக்கிரமா கெட்டு போகாது. So அதனால வந்து அவங்க என்ன பண்றாங்க அப்படின்னு கேட்டீங்கன்னா they are adding the sulfur. ஸோ இந்த ப்ராப்ளம் நம்மளுக்கு தெரியாது. ஆனா நம்ம என்ன பண்றோம் அப்படின்னு கேட்டீங்கன்னா நம்ம வந்து எண்ணெய் வைக்கிறோம். சார் நான் கோகனட் ஆயில், வெர்ஜின் கோகனட் ஆயில் தான் நான் வைக்கிறேன். பட் தே டோன்ட் நோ தே ஆடிங் த சல்ஃபர். ஸோ யூ கேன் மேக் த கோகனட் ஆயில் இன் யர் ஹோம். You just give the coconut, you make it, you just buy the coconut and give the copra to that merchant and make it grind well, and you just bring that coconut oil. You can drink also. If you drinking the coconut oil, what will happen means even it's the best medicine for cancer. If you're taking the coconut, you know who are the Kerala peoples, they are free from cancer in olden days, but now they also forget to follow the coconut oil. The coconut contains radiotherapy and chemotherapy. The one and only thing is having the radiotherapy and chemotherapy. The coconut only having. None of the fruits or none of the vegetables having that radiotherapy and chemotherapy action. None of the things having. Only the coconut having that radiotherapy and chemotherapy action. Kindly take that coconut. Minimum of 2 days or 3 days. You just take the coconut oil daily. The virgin coconut oil 1 spoon a day. You can free from the disease. Why? Because our Acharya is giving more importance to that. So only those who are going for Sabrimala, they're taking pour the oil, pour the ghee in that coconut and they're taking. Why? Because it will கெட்டு போகாது. அப்போ ஒரு கீயே கெட்டு போகாது அப்படின்னும் போது அப்ப நம்ம உடம்பு கெட்டு போகுமா? So that's why from the starting itself I am saying giving more importance to the oil. So if you giving more importance to the oil, you can free from the disease and we should not go for the doctor. In olden days, they used to say keep apple daily சாப்பிடுங்கன்னு சொல்லுவாங்க. Keep the apples a day, doctors away அப்படின்னு சொல்லுவாங்க. If you taking the apple nowadays means we should be very close to the doctor only. So please take amla daily. It will give more important. It gives vitamin C. It will enhance the immune system. It will enhance the immunity power. It will give strength for that hair. It gives strength for it having a phosphorus. So it gives more important for teeth and then hair, and then it gives strength to the eyes, and it gives complexion to skin. It is free from the what do you say? It is a sagalakala nivarani. So kindly take amla. In our Ayurveda, we giving Chamanaprasha. The Chamanaprasha is made up of one and only amla along with other drugs. So it is a best regenerative therapy. those who are having that diabetes, those who are having the diabetic problem, kindly ask without a sugar level, kindly give Chyawanprash. There's having two types of Chyawanprash. One is sugar based, and another what is it? Sugar means candy based, and another is non-jaggery based. So we can get that non-jaggery based for diabetic level. We can take that. It is a best regenerative therapy. So we can take that Chyawanprash. Even this in this Corona period, it plays a major role. Sir, in Corona, nothing will be happen, sir. Why? Because if you following the Ayurveda and Siddha yoga in the proper way, our PM giving more importance to that. Why? Because they're giving a more importance means if your breathing level is very, very free, automatically what happen? The disease will not be occur. If you going for, if you taking Talisadi Churnam, if you taking Karpradi Churnam, if you taking Tulasi daily, daily take 2 Tulasi, your respiratory channel will be free. Even TB patient, they can take a Tulasi. So each and everything we can follow the Ayurveda and we can be free from the diseases, sir. Hello.
Hello, sir. Sir, one out, sir.
Yes.
Sir.
Hello. Hello.
Kindly ask for
Hello,
doubt.
sir.
Yes, sir. Yes.
Excuse me,
Said
sir.
Sir, hello?
non-vegetarian will cause rajasic effect, no, sir.
Hello.
Hello, can you hear me, sir?
Yes, sir. Yes, sir.
Yes. In one of the context, you said we need to eat the eggshell, no, sir.
Eggshell, sir.
Eggshell will cause any rajasic effect on us, sir.
What, sir?
Rajas, you said rajasic diet, no, sir. Like eating non-vegetarian will cause rajas.
No, sir. The eggshell nothing problem, sir. If you taking that egg only, it will be having the problem. But the shell is having no problem, sir.
Okay, and
it contains selenium, magnesium, copper, each and everything in that eggshell, sir. So you can take it, sir. No problem.
And this Singha Gajasana, you said, no, sir. What is the spelling, sir?
Singha Gajasanam, sir. Singha Gajasanam.
Spelling, sir?
Singha, Singha, Singha.
Yes, sir.
Gajasanam, Garga.
Garga.
Gargasanam. Singha Gajasanam.
Sir, it is for hypothyroid, right?
Yes, 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 madam.
Singha Gajasanam for hypothyroid or thyroid, any type of thyroid, madam, we can use it.
Sir, for early graying of hair on a 16-year-old girl, sir, what is the solution, sir? Early graying, nerchi pogudu.
Gray hair. Okay, madam. You just take that, what is it, Bringaraja, that is Vella Karsalanganikire, along with 2 Amla, Nellika, Nellika, and then Kunja Adik Chembarti, that Chembarti poo. ஒரு நல்ல அரைச்சிட்டு அதை என்ன பண்ணுங்க, ஒரு வாரத்துல ஒரு நாள் பேக் கொடுத்து 2 days பேக் கொடுத்துட்டே வாங்க. 1 hour அந்த ப்ராப்ளம் சார்ட் அவுட் ஆயிடும் மேடம். ஒன்றும் பிரச்சனை இல்லை.
So please explain in English also.
Okay, sorry madam. Actually, Bringaraja, white Bringaraja leaf, and then along with the 2 Amla and then Chembarti leaf. So if you take that Chembarti and then Amla and then Bringaraja, it gives a nice result, madam.
So what is Chembarti leaf?
Suggestions
For
for
action
the
application.
Yes, sir. What is?
For action application.
Yes,
Sir,
understood.
Hello.
Sir, can you give the suggestions for the hyperacidity and acidity?
Yes, sir. For hyperacidity, kindly take ghee, sir. Daily you should take the ghee. After that, you should take what do you say? After taking the food, you just take a little bit of sweet, any type of sweet after taking the food, and then our medication, what that Inga Astaka Churnam or Astaka Churnam, sir. So it will be the best relief.
Okay, thank you, sir.
Sankavati, sir. Sankavati.
Sir,
Yes, ma'am.
can you tell us something about some remedy for ankylosing spondylitis?
What, madam? Pardon?
ankylosing spondylitis.
Okay, okay. For you, what's your age, madam?
Age is 42.
Okay, madam. In our system of medicine, the spondylolisthesis is a Servilan. We can use it. Servilan along with the Shirabala Thailam. It gives a best remedy. So you can use a Shirabala capsule morning one and night one, and then what that Gandha Thailam. Gandha Thailam also we can use along with that Shirabala, Gandha Thailam, Shirabala, and then Servilan capsules gives a nice result.
Sir, can you tell me the spelling, sir? Thank you so much, sir.
Gandha Thailam, GAN.
Yes.
NDHA.
DHA.
TAI.
TAI.
LAM.
LAM.
LAM capsules. Gandha Thailam capsules.
Capsules.
Yeah, Shirabala. KSHE.
KSH.
EE. ERA. BALA. Shirabala capsule.
Capsules.
Yeah, it gives a nice result.
Okay, dear
Sir, one
participants,
question.
sir,
One
Yes.
last one, sir. Good hair growth, and secondly, depression for old age people. Good hair growth for youngsters like me or my daughter maybe, and depression is something for old age for my parents because they're lonely.
Okay, we can use that Mahabringaraja Thailam. It gives a nice result. Mahabringaraja Thailam.
Okay.
Mahabringaraja Thailam plays a major role in the hair. And then, what do you say? If you taking daily and along with any iron tablets like Kashisa Basma tablet or whatever may be, or in a market it is available. Bringaraja tablets are available, so you can purchase the Bringaraja tablets.
Okay.
So Ayaskriti like that you can take along with Ayaskriti and Bringaraja Thailam. It plays a major role in hair fall.
Okay. Ayaskriti.
Ayaskriti.
Okay. And depression, if you can suggest something to eat. I know it's a big disease, but I mean, for old age.
What from? Pardon?
Depression, loneliness.
Depression.
For old age, they can't do yoga.
Ma'am, you can take ashwagandha.
Okay.
Ashwagandha along with tapikachu.
Along with?
Tapikachu.
Pikachu. Okay.
And then make it of 100 grams and 100 grams mixed together.
Okay.
Morning 1 spoon and night 1 spoon in the milk, madam.
In milk, morning and night.
Yeah.
1 spoon in milk. Okay. Thank you so much.
Thank you.
Thank you so much.
sir, last question, sir. Sir, my last
Madam.
question. Dr. Sukundan, sir.
Yes, madam. Yes, madam.
Sir, please, we have to clarify all the participants' doubt through the mail and phone call, sir, due to want of
Okay, madam.
shortage of time.
Dear participants, thank you very much
Thank you.
for your inquiry and all. Sir, doctor is also having work, and due to a shortage of time, we have to close the session as per our instruction of our authorities. No problem. Sir is giving his mail ID and phone number. Whatever you have a doubt and clarification, you please ask over phone. Yes, sir. With your permission, sir. So please ask and
Yes, ma'am. Yes, madam.
clarify your doubts through the mail also. He will definitely, sir is easy approaching person. He is a very humble and dedicated service oriented mind. So please, dear participants, don't mistake the organizing team, because due to want of shortage of time, we have to close this session for this purpose only. You please contact Dr. Sugundan sir through the mobile or email. You have to, because spelling and all, this is the new term and all. For that reason, better you have a prescription. Correct prescription, get the correct prescription from doctor. I think it's correct, I think, sir. Please, sir.
Yes, madam.
Please, doctor will always help our students as well as who are asking. Okay, sir. Thank you, sir.
Okay. Thank you, ma'am. Thank you for giving a section.
Sir, yes, sir. Yes, sir. Sir,
Thank you for Annamala
thank you very
University
much,
for
sir.
giving a nice session, ma'am. Thank you so much.
Yes, sir. Yes, sir. Thank you, sir. We have a wonderful session we've had because all the participants are very much interested because due to the COVID-19 situation, and sir has explained about the ancient Ayurveda in model board.
because Ayurveda is the science of life. We has described various Sikicha and Rasayana where the disease arise and root causes of the diseases and how the nadis plays the major role. That is Vada, Pitta, Kapha, and during this, especially this situation, each and every Prakriti and depends on the Prakriti plays a major role of Vada, Pitta or Pitta and Kapha. Like this, he has nicely explained and he has explained Manoradha's Vritti and Mandakini and Ama, Virya and so many terms he has given and correlated the yogas also and Inima and Anjarapeti mainly for our ladies. Anjarapeti is the very important aspect. He has mentioned the items also and he has detailedly explained about the food habits, how to take and when to eat better. We have to take on time and Nazia daily we have to take and Tambula he also explained very nicely, sir, for maintaining our energy level and increasing in calcium level and good for the digestion and the salt water good for the digestion. He has mentioned for purifying water also, how to purify the water. That also he has explained very nicely, sir. And he has clarified without tiring all the participants' inquiries. Thank you very much, sir. Like infertility, loss of smell and loss of taste, and various kashayams, various churana he has mentioned. So finally, Ayurveda as a complementary system of healing that we all know. So Vata, the energy movement to maintain the balancing Vata, we should keep warm, keep calm, avoid cold and frozen. And Pitta, the energy of digestion and metabolism. And Pitta types have maintained the qualities of fire and all. He has advised to take ghee and so Kaba also the energy lubrication. He has explained nicely and definitely this lecture will reach to the everyone. So India has a long history of a strong base of Ayurveda, Veda, and this is the traditional system of medicine. And he has advised to practice yoga also, and coconut oil and amla, seven chavarna prash, Tulasi, ghee, sir, list poite irukku, sir. So due to shortage of time, I have to post my because Amma, you have explained a very enormous information to our participants on behalf of the organizing committee and the Center for Yoga Studies and Annamalai University. Thank you very much for your nice presentation. Thank you very much, sir. Thank you, participants, for your patient listening and active listening and wonderful clarification raised also. Definitely don't mistake the organizing team. Because of the instruction of the organizing, we are giving this information. You please contact our Dr. Shugundan sir through his mobile number and email. Definitely he will answer. Not now. Always you have a Ayurveda physician means you have to mind it. Dr. Shugundan sir from Annamalai lecture. You just remember his name. Thank you very much, sir, on behalf of the organizing committee again. Thank you, sir. Thank you. So we have to end with the closing session prayer. We have to end with the session with the closing prayer. Malam sarirashya chavaitikena yogapakarudam pravaram muninam padanchali Shaliranadoshmi Om Shanti Shanti Shanti. Thank you.
Thank you, one and all.
You please fill up the feedback link form which is posted in the chat box. Dear participants, you have to fill up the feedback link form also. Please, thank you. We will meet you tomorrow. Thank you.
Dr. Shanti ma'am, excellent ma'am, thank you. Thank you so much ma'am. Sushila ma'am, thank you so much.
Thank you, ma'am. Thank you.
Very nice ma'am. Please arrange more sessions with Dr. Sikandan. Very useful ma'am. Thank you ma'am.
Thank you.
धन्यवाद माताजी. सुशीला माताजी. सुशीला माताजी. धन्यवाद. Excellent section. Thank you all.
You have to please the president. Mail ID, sir, the mail ID. Phone number put at chat box. சூப்பர். ஓகே ஓகே. நல்லா இருந்துச்சு சார் ப்ரோக்ராம், ரொம்ப நல்லா இருந்துச்சு. எல்லாருமே இது ஃபீட்பேக் நல்லா இருக்குன்றாங்க. உங்க நேரம் சொல்லியிருக்காங்க, சாட் பாக்ஸ்லேயும் போட்டாங்க சார். அது அதுவும் சார் உங்கள் மொபைல் நம்பருக்கு சாட் பாக்ஸில் போட்டீங்க, உங்கள் மெயில் ஐடியா அப்படி கொஞ்சம் சாட் பாக்ஸில் போட்டிங்களா சார்? நான் அதை பார்க்கல, கவனிக்கல. நான் மொபைல் நம்பர் பார்த்தேன். ஓகே சார். ம்.